Are the RDA guidelines really all we need to be concerned about when talking to our patients regarding optimal health? Should we be discussing vitamins and minerals with our patients? At the very least, is there really science behind the use of vitamins and minerals? And if so, how do we evaluate our patients' needs? And how do you apply practical and nutraceutical supplementation for patient education? Are these some of the questions you have regarding nutrition and supplementation? If so, this module is going to answer those and many other questions you and other practitioners have been asking for years. It's become increasingly aware that most of us are not deriving our optimal intake of nutrients from diet alone. In this module, the reasons for this will be discussed, as well as the differences in recommended daily allowances and optimal daily allowances for vitamins and minerals. Various protocols using nutraceuticals and natural medicines, including scientifically verifiable doses for different medical conditions, will be covered in depth. The definition and types of nutraceuticals will be covered in great detail, along with the definition and a short explanation of functional foods. We will also present articles discussing natural medicines and case studies involving nutrition, lifestyle, and nutraceuticals, as well as herb-drug interactions, vitamins, minerals, omega fatty acids, and amino acids. Finally, this module looks at glyconutrients as well. Now, upon completion of this module, you'll be able to understand and to apply practical nutraceuticals and supplementation for patient education and office programs. You will also be able to apply guidelines for nutritional status assessment through blood, urine, and diet analysis, as well as know how to evaluate RDA guidelines versus optimal and therapeutic levels of nutrients, nutritional supplement properties, including dose adequacy in a variety of forms, manufacturing guarantees of potencies, and avoiding toxic contaminants. Now, there's 4 sections which you'll need to complete. The first section is the bulk of your program, which includes required readings in the form of PDFs, PowerPoint presentations, and outside links to important articles. Throughout this program, you'll be able to post questions to the faculty Let's start that section over. Further. And we'll just use this as a separate. Go ahead. Now, there's 4 sections which you'll need to complete. The first section is the bulk of your program, which includes required readings in the form of PDFs, PowerPoint presentation, and outside links to important articles. Throughout this program, you'll be able to post questions to the faculty through the module form and communicate with your classmates. You will then move on to the case study sections, which include quizzes to test your understanding of the material and to experience real-life applications. Following the case studies, you'll move on to the final examination. Now, even though the final exam is an open book examination, we encourage you to think through the process rather than just finding the answer and move ahead. Because after all, when you complete this module or any of our modules or fellowship programs, we want you to leave with a real understanding of how to apply the knowledge you've just received. Lastly, to end this program, we ask you to fill out a short survey to give us your feedback on the overall module. You can then click on Certificate of Completion, where you'll be able to download your certificate. We hope you enjoyed this module, and remember, if at any time you get stuck on a section, have any questions that you just can't get answered through the form, or have any questions or concerns whatsoever, you can always get a hold of a staff member through our email at info@theifim.com. We want this experience to be a great experience for you and one that you can translate to your patients as well as to your colleagues. So good luck on your studies and enjoy the learning process.